So this muscle that pulls down, procerus, we're gonna get, and then we're gonna also get this corrugator. Needs two because it's pretty strong. It's this muscle across the forehead that tells people you're angry. And now when I mark these, I make sure there's always little blue blood vessels around the eye, so we try to avoid any of those so that we won't get any bruising. Okay, so we're gonna drop your Botox. We use the smallest needle we can. Here comes your first sting. How you doing? It is kind of amazing that you can do this, and it really, really improves the appearances with no downtime and not a lot of pain. This is the most popular cosmetic procedure, surgical or non-surgical, across the country, Botox. So we did around your eyes. Now turn your head towards me and chin down just a little. Now this area, because your forehead is a little bit shorter, this area is this Botox, unit that we're injecting, it does diffuse a little bit. So you're gonna get a little bit of an effect on this horizontal line across your brow. With Botox, you can't lay down for 4 hours. No vigorous exercise or hot tub or sauna for 4 hours. After that, you can do whatever you want. Resume normal activity. Well, your Botox doesn't take effect for 3 to 7 days, so definitely tomorrow everything will look just the same. The filler, however, you can see right away, and sometimes there's a little bit of redness that can last 1 or 2 days. Most people say by the same evening that the redness is gone. And you can wear makeup within 15 minutes after your filler or Botox. This kind of thing, the fillers are always a little bit more painful than Botox. Botox pretty much doesn't hurt, but fillers you feel a little bit of a sting. Put your chin up for me as much as you can. There we go. We're going to start with this nasolabial line here. Okay. Alright, so we use about half the syringe there. Open. Open your mouth. Oh, yeah, there you go. When you reach inside, you're molding it. When you first put it in, you can mold it a little bit. You kind of give it a more smooth look that way. Now you can already see that her left side is a little more smooth than the right already. Now some people, once you start doing the filler, you realize that they're going to need more to get a correction because their skin isn't as pliable. So really, people will ask me ahead of time, how much filler do I need? And I can guess by looking at how deep the lines are. And then the rest of it is kind of, once you get into it, you see how much someone's really going to need to get a full correction. And the reason why that's important is because it's usually charged by the syringe, so if you can get away with less filler, that's good for you. But I will say most people use a lot of filler the first time, and then when they come in for their repeat treatments, they don't require as much filler. I guess I should qualify with that with how quickly you come back for your next treatment. So if you still have a little bit there, most people, once they see the results, don't wait until it goes completely away. And then look, sometimes you don't really see what lines need to be treated until someone smiles. These need to be filled a little bit more. So until she smiled a little bit when she was talking to me, she looked really, really smooth. But we do need to put a little more. It's normal to have a dimple, but you don't want it to be quite so deep and etched in. So we fill that. She'll still have a dimple, but it'll be a nice soft one. So the second you put the filler in, you can see a result, but the result with the nasolabial fold gets better over time, because the filler is actually hydrophilic, which means it absorbs water. So it looks really good. We can already see a difference in the depth of your folds here and this area. And then I built up the corners of your mouth. That kind of gives the corners of the mouth an upturned look rather than a downturned shadow, because that can almost make it look like someone's unhappy or unhappy face kind of thing. So we fill these corners. It gives a nice lift. So it gives you a much more youthful look to your face. And then when the Botox takes effect in 3 to 7 days, you'll have a little bit of a brow lift, and this area will be nice and smooth.